Millions of vials containing Pfizer's vaccination are already rolling off the production line. It hasn't been approved for use yet, and the question is, if it does pass safety tests, will people want to take it? This morning, the Deputy Chief Medical Officer said he would.
If I could be at the front of the queue, then I would be. Let me say to you this, I think the mum test is very important here. My mum is 78, she'll be 79 shortly, and I've already said to her, Mum, make sure when you're called you're ready.
That's because the NHS is also ready, he said. So they'll be called in through the door.
Come through the door
and
flow in through here. We have 10 clinical rooms here.
This GP practice has already planned how to vaccinate masses of patients, but there are huge challenges to get it done quickly.
With the Pfizer immunisation, it's frozen, it needs to be defrosted, and that then needs to be drawn up individually from ampules. That takes more time, it's more fiddly. If they're not used pretty soon, they're then wasted. And I have to say, sometimes when we do a flu clinic here, less than 50% of the patients that we've invited actually show up.
Phase 3 of Pfizer's vaccination trial isn't yet complete. But to speed up the approval process, the UK's regulator, MHRA, has been reviewing the data throughout the trial. When Phase 3 is finished, it means final approval could come within weeks. It must pass safety tests, though, before any rollout date. One expert survey suggests 15% of the UK would refuse to take a vaccine.
There are some people that are just not going to do it at first. And I think what we need to do is go with the willing, because there are a lot of people who do want this vaccine or a safe and effective COVID vaccine. And the more people are taking it, the more there will be a confidence in just that peer effect.
The Prime Minister reminded us today that when it comes, the vaccine won't deliver a knockout blow. For it to make any difference at all, though, it will need millions of us to have it.